Hello and welcome to the program. This edition of Newsroom series covering Nigeria's Northeast. I am Bukola Koka. First, the main stories. Governor Caleb Mutfwang of Plateau State has announced the immediate closure of St. Academy School and ordered a full investigation into the cause of the school building collapse. The governor gave the order when he visited the collapsed building premises for assessment of the situation as he went round the school premises with the principal and staff who were at the school to receive him. He also expressed his condolences with the victims and families of those who lost their lives in the Jos school building collapse. And to the south in Delta State, to be precise, residents are voting for local council chairpersons and councillors. The election is holding in 5,863 polling units, 500 wards across 25 local government areas in the state. Earlier today, Governor Sheriff Oborevori cast his vote in Ward 6 of a local government area, where he expressed confidence that the PDP will have a clean sweep. He reacts also to the issue of local government autonomy, saying his administration has always supported the issue of financial autonomy for governments at the grassroots. Council elections are also taking place in Adamawa State today in all 21 local government areas of the state. 1.9 million residents are eligible to vote in today's elections, with electoral officers spread across the 21 local government areas. Chairperson of ADCIEC, Mr. Mohammed Umar, says security is available to ensure the polls are hitch-free, and he urged residents to make their registration count. He promised that he and his officials will work round the clock to ensure a level playing field for all. Legal practitioners are lamenting the negative impact of corruption, lack of merit-based appointment, and political interference as major factors eroding judicial integrity in Nigeria. At the ongoing 2024 Law Week in Jalingo, the Taraba State capital, organized in honor of Governor Abu Kefas, the legal practitioners are seeking judicial autonomy to end nepotism and lack of transparency in the practice, as the governor assures of improved welfare for the judiciary.
It's a week-long activities for legal practitioners within and outside Taraba State, which commenced with a road walk and a football competition to keep fit and ensure mental stability in the discharge of their duties. Away from the physical activities, the Law Week also seeks to promote awareness and understanding of legal rights and foster respect for the rule of law. Guest speakers insist it's time to embrace new ways of doing things through artificial intelligence, while lamenting lack of judicial autonomy, political interference, and corruption in the practice.
Wherever you go, legal practice is legal practice. And since the Attorney General is here, I must say that you must ensure the independence of judiciary. Independence of judiciary is tantamount to the development of the state. Nobody will come and invest in your state if you manipulate judiciary.
The executive has an overbearing dominance on the other branches of government. The executive almost is trying to annihilate or asphyxiate, suffocate the judiciary, the legislature. They give out or dole out handouts, peanuts to the judiciary, to the legislature. How can democracy consolidate and thrive in such a situation? And then we have a skewed federalism. There's an overbearing centralization of power in the federal government.
On his part, the Attorney General of Taraba State, Yakubu Mekasua, highlights the efforts of the Kefas administration to make life and work easier for legal practitioners.
Increase in monthly running cost of the judiciary by over 500%, from 15 million to 100 million. Restoration and improvement of scholarship or bursary allowance to Taraba State students in the Nigerian Law School. Approval approval and commencement of an Attorney General's chambers. When completed, it will be the best in the country.
There is further assurances from the state government on improved welfare packages for legal practitioners to foster inclusiveness and uphold the rule of law.
We recognize the pivotal role of law in navigating the complexity of our modern world. The theme of the Law Week, Beyond the Present, call upon us to embrace forward-thinking strategies that anticipate challenges, foster inclusiveness, and uphold the principles of fairness and accountability.
The legal practitioners are here optimistic that the step taken by the state government reflects plots to ensure its judicial integrity and autonomy as they award him as the Man of the Year.
You're still on to Newsroom series on Channels Television. We now interrupt our programming at this time to bring you a live coverage of the APC rally taking place in Ebonyi State, specifically at the Pa Ngele Oruta Township Stadium in Abakaliki, the state capital. And this continues on our DSTV channel, but our programming on all other channels continue. Moving on now, the World Bank, in partnership with the federal government of Nigeria, is implementing energy projects that will indeed provide electricity to federal universities and teaching hospitals across states of the Federation. With a funding of $1 billion from the World Bank, the project will explore the entrepreneurial potential of tertiary institutions while also providing trainings to Nigerian students. During an inspection tour to project site in Maiduguri, a combined team of World Bank officials led by the practice manager, West Africa, and representatives of federal government say they will partner with Borno State on renewable energy opportunities. The Rural Electrification Agency is the implementing agency of the federal government's Energizing Education program, designed to provide dedicated solar hybrid power systems to 37 federal universities and 7 university teaching hospitals nationwide. The University of Maiduguri is one of the second phase beneficiaries, with a 12 kilowatts plant built to provide electricity to the university community and the teaching hospital. The managing director of the Rural Electrification Agency, Mr. Abba Abubakar, leads a delegation from his office and the World Bank team on a courtesy visit to the state government.
Ladies and gentlemen,
they are received by the deputy governor, to whom they explain their mission.
I'm happy to say that University of Maiduguri is one of the beneficiary universities, not only the university but the teaching hospital. And that project is also the biggest of all the phases. We are about to deploy a 12 megawatts electricity in this university, providing not only the university but the teaching hospital.
With such initiative, I believe we need not to worry too much on the national grid, because already now the people of Maiduguri and its environment are not feeling, the absence of the national grid in our state because of the power plant that we have already now in Maiduguri.
And shortly after, the team visits the acting Vice Chancellor of the University of Maiduguri to continue conversations on the maintenance of the Energizing Education program and other opportunities.
I would like to urge the university and challenge the technical staff of the university to understand the sustainability plan that the REA has developed, and as well as devise an internal means to implement and ensure the implementation of that plan for the university and the students to continuously benefit from this project.
Today, the world is moving towards solar. I went to China in 2005 and I saw that World Bank had done a $100 million loan on giving solar to schools and universities. And I was curious why. And I realized that in addition to giving clean energy, it created curiosity in the students to learn how solar works. And then we help them create training programs, which are clear certification programs for operations maintenance, different designs, research, PhDs. And today, China has 300,000 megawatts of solar.
Later, they meet with students on training at the project site within the premises of the university. When completed, it is estimated that the solar power plant at the University of Maiduguri will serve 350,000 students and 50,000 academic and non-academic staff. Governor Inuwa Yahaya of Gombe State has requested that President Bola Tinubu to intervene to help revive the crude oil drilling project at the Kolmani River 2 well, located on the boundary of Gombe State. Speaking at the State House after a meeting with the President, Governor Yahaya expressed disappointment that the project has not commenced 2 years after its commissioning, calling it an unfortunate development.
I came to see Mr. President as a follow-up to the recent developments in the country, especially in the economy, with regards to food security, and also with regards to the recent developments in the polity. And our engagement has been very robust. We touched on all the issues, and I'm satisfied and I'm convinced that Mr. President is ready and has been doing his best and will continuously do his best in order to deliver on the mandate and see that Nigeria is out of the current situation and has improved and has gone to catch up with the rest of the developed world. Close to 2 years now after the foundation laying for an integrated institute development that comprises of a 250,000 capacity refinery and 350 megawatts power plant and a 2,000 ton per day capacity fertilizer plant, which was supposed to take off. And in fact, it's part of the discussion I had with Mr. President, believing that once he steps in, maybe you will see activities back.
And there's more from Gombe State after this break, but as the health sector is set to provide affordable healthcare services and cut financial barriers to accessing these services. That will be our next stop after this time out. Join us again. Welcome back. And now to the healthcare sector in Gombe State. In order to provide affordable healthcare services to the people and cut financial barriers to accessing these services, Governor Inuwa Yahaya has initiated the State Contributory Healthcare Management Agency, Go Health for short, which officially took off in 2021. And 3 years after, the agency appears to be recording some progress and resonates with the rural-urban population through the use of state-of-the-art, user-friendly digital technologies to provide healthcare.
In the past, many people in Gombe State seldom visited hospitals to get medical help due to the high cost of treatments, resulting in avoidable negative outcomes. The era of over-reliance on chemists and unregistered medicine stores as alternative to proper hospitals is now history, with the launch of the Contributory Healthcare Management Agency, Go Health, in 2021 by Governor Inuwa Yahaya, who was the first to register.
Go Health is established with the sole aim of ensuring that all residents of Gombe State have access to quality healthcare services at an affordable cost.
His Excellency promised, in his 2019 campaign manifesto, that if elected into office, he will put in mechanisms to ensure that the people of Gombe State can access healthcare services at an affordable cost, and that will be of very good quality. It was enacted and signed in the same year of 2019. Go Health is for everybody, the rich and the poor alike. Just like we are giving priority to the poor in the enrollment to the equity program, the rich also have the access and the privilege to come and register under either the formal sector or the informal sector program. So Go Health is for everybody. It's for the entire residents of Gombe State.
While emphasizing that Go Health pushes the envelope towards achieving universal health coverage and edges out financial barriers with over 300,000 beneficiaries so far, Dr. Musa explains that the agency's equity program targets 1 million persons who are neck deep in multidimensional poverty.
We were able to go around all the 114 wards and enumerated over 1 million potential beneficiaries of the equity program. And what we did there is that we developed what we call a vulnerability index score, whereby this large pool of 1 million people are graded based on their level of multidimensional poverty. And then we prioritize the enrollment of those who have the highest vulnerability score. That means they are the poorest of the poor in that pool of register.
With the deployment of state-of-the-art, end-to-end user-friendly digital technologies, health workers say the Go Health initiative is saving the lives of patients visiting their facilities in all 114 wards of Gombe State.
From the coming of Go Health, you see pregnant women are able to afford antenatal care, prenatal care, and even postnatal care, and even in surgeries concerning CS. Before, some of them will not be able to afford CS, but because of Go Health now, with the slash in price, they are able to afford it, and women are being saved.
After enrollment in the package designed for formal and non-formal segments of the society, clients pay 10% of the total cost of medical treatments, lifting heavy financial burdens off their shoulders and bringing a huge sigh of relief. With the Nuwa Yahya receiving an award of excellence in healthcare delivery at the 2024 Nigeria Excellence Awards in Public Service, Go Health stands out as one of the state's flagship programs, which has demonstrated an ability to reduce the cost of Medicare.
Now let's get a fuller perspective on Gombe State's Go Health now. And joining us for this conversation is the Commissioner for Health in Gombe State, Dr. Habu Dahiru. Good afternoon and welcome to the program.
Thank you very much. Good afternoon.
Yes, let's start by asking you to elaborate on the state's efforts to ensure free health care for the people and indeed the cardinal objectives of Gombe State's Go Health scheme.
Well, the main objective of the scheme is to provide health care to everyone. For us to achieve universal health coverage, I think this is the way. Health financing has always been challenging. And when we discovered that establishing Gombe Contributory Scheme will give us the opportunity to for everyone in Gombe to have access, we started with the formal sector, meaning all the civil servants. We dialogue with the labor, and they all keyed in. And later on, we went into the local government. Now the teachers from the local government, we also dialogue with the Nigerian Union of Teachers, and we convinced them the importance of registering under the scheme and the benefits on them and their families. Today, we're able to enroll all the civil servants in Gombe State, both in the state and the local government. We also started the enrollment of the informal sector. We've done sensitization to also enroll tertiary education program for students at the tertiary institutions and also pensioners. But this is we've now done the stakeholder engagement and we've sensitized them. We're now starting registration. You recall that the basic healthcare provision fund takes care of the under the equity takes care of the poorest of the poor. So in that regard, a vulnerability index curve was made. And we got very, very vulnerable, very poor, cannot afford. So we have registered them in very large numbers across all the LGS. What is so this in Gombe is you can register in the comfort of your room using a handset and in local language or in English. So registration becomes a lot easier. People don't need to travel. to the headquarters in order to register. Again, we also established call centers in all the 11 local governments, and we provided logistics for them, and they're on solar to ensure that power is constant and everything is digitalized, and it's make work very easy. The contentment from the patients. With the Go Health, we also established the Gombe Drug Management Agency, where affordable drugs are there. Now, it's one thing for you to come to the hospital and get consultation under the Go Health program, and it's another to get reliable drugs that are affordable. So the two programs made Gombe stand tall, and that's why probably His Excellency was also rewarded in this regard, that Gombe State came high in provision of health care to the people.
Yes, and from your explanation, you land on that thought there now so that I can come in. You can land on that thought so that I can come in.
Okay. What I was saying is, with the establishment of Gombe Contributory Scheme and the Drug Management Agency that ensured regular, sustained drug supply in the facilities. Now, when you Go Health register you, and you have access to every facility at any time, 24/7, and especially women and children. These are the large numbers that come to the hospital, and on the program, when you register as a household, the husband and the wife and the 4 kids are registered, and they have access to healthcare from consultation to laboratory services to surgery and also medications.
Indeed, and from your explanation, it appears as if the scheme has covered all age groups and categories. So what are the numbers?
Absolutely.
What are the numbers now that you've been able to secure registration for across these age groups? And considering that there's a whole gamut of healthcare, from tests to consultancy to treatment and drugs that you talked about, what is the value that they contribute? And beyond the basic healthcare, what about complexities in healthcare? What intervention does the state government offer beyond an individual that is requiring basic healthcare that now requires treatment for maybe terminal conditions? So 2 questions there.
Yes.
The numbers that you have covered
with that,
and the value.
Having registered, we first of all, before we even establish Go Health, we ensure that all the facilities are ready to provide service. Meaning, we upgraded all the 114, at least 114 PHCs. Meaning, every ward in the local government have upgraded primary health care center. Then the secondary facilities, we upgraded the general hospitals and the cottage hospitals. Then in the human resource for health, we also recruited more hands, because under this program, every primary health care center must have minimum a midwife and other laboratory staff for them to work efficiently to cater for antenatal service and hospital delivery, which is one of the major things. As you know, in Nigeria, or in particular in Gombe, the maternal mortality was high. So how do we contain it? Is to provide adequate prenatal, antenatal, and postnatal care. And through that, midwives are very key. Then the medical officers and other staff required. And that is why we rejig the human resource in health in Gombe. And then we provided the registration and ensured that infrastructure-wise and equipment were procured to, we improved the infrastructure, we procured additional equipment to ensure that services are rendered without any hindrance.
There's more to touch, but we'd like to thank you very much, Dr. Habu Dahiru, the Commissioner for Health in Gombe State. Thank you very much for your time.
Thank you.
The federal government, under its agency Great Green Wall, has embarked on the sensitization of some select schools and communities in Yobe State on the dangers of felling trees to source for energy. The Director General of the agency, Yusuf Meina Bukar, represented by the Deputy Director, Resource Mobilization, Habiba Tumsa, and her team, also visited Governor Mai Malabuni and decorated him as ambassador of the Great Green Wall. The team, which was in Yobe to commemorate the 2024 Great Green Wall Day with the theme Fueling a Greener Future, Green Cooking for Sustainable Development, described tree felling as the major human factor affecting the environment. And that sums it up on Newsroom series, this edition that covered Nigeria's Northeast. Join us again same time next week when we'll bring you another round of editions. I am Bukola Koka. Bye for now.